So now it gives me great pleasure to introduce our second speaker, Kamali Clora. As you can tell from the audience, Kamali was chosen by his peers to deliver this year's student address. Kamali, I'm going to embarrass you for just a second and do a little bit of an intro. Kamali's origins in public health and healthcare started as a CVS health technician when he administered COVID-19 vaccines in the Detroit metropolitan area during the pandemic. He then served as a patient access specialist in hospital radiology, ensuring that patients received timely diagnostic testing, getting that bird's eye view into the degree to which access determines health. These experiences drew Kamali to the health management field. He did an administrative internship at Mass General Hospital and then brilliantly decided to come down 95 to us here at the Yale School of Public Health. During his time at Yale, Kamali has not just been an exemplary student, but has also contributed to the community in other ways. He served as one of the executive directors for the Haven Free Clinic, where he led the provision of care for more than 600 uninsured patients in the greater New Haven area. He's had the privilege of serving his student community on the Presidential Search Committee Student Advisory Council. No, I have no insight into what's happening with the presidential search. And he's also served as a teaching fellow for 3 courses across the School of Management and YSPH. Kamali's internship at the Mayo Clinic this past summer reinforced his decision to pursue an administrative fellowship, leading him to continue his journey next at Northwestern Medicine. Personally, it has been an absolute privilege to get to know Kamali and many of you over the last year, and I can't wait to see what you're going to do next. Kamali, the stage is yours.
Pressure. Wow, it's packed in here. It goes to show you how loved you all are, so take that all in. First, want to say good afternoon, Dean Ranney, friends, family, faculty, and staff, and honored guests, and fellow graduates. Or as we would say in Detroit, what up, though? Thank you all for being here today to celebrate this remarkable milestone. Can we give a round of applause for the people who have helped you get to the seat you're sitting in today? Now, before we dive in, I would like to credit ChatGPT for writing 90% of this speech. I only wrote the greeting. Kidding. No, I'm not. As I'm on this stage, I think back to the reasons why I chose the path of public health. I remember my family moving from Detroit to a suburban area outside of the city, and I was young at the time, but I recall the stark differences in the racial demographics and urban development of this new, more affluent town. It amazed me that 2 places just 30 miles apart seemed worlds away, and it wasn't until I had my first public health course in undergrad that I began to put this into perspective. These 2 disparate communities had a difference of 15 years in life expectancy, a result of the infrastructures at play doing exactly what they were designed to do: neglect. Where you and I see injustice, others see wealth and opportunity. It was this realization that propelled me into the field, specifically down the rabbit hole of healthcare. As I interacted with patients during pivotal junctures in their ambulatory care journey, many of them described healthcare as having winners and losers. It makes me reflect on the words of the late Dr. Paul Farmer, who once asked, if access to healthcare is considered a human right, who is considered human enough to have that right? This question embodies the very essence of our education at YSPH. It reminds us that true progress in public health means leaving no one behind, and that we must dismantle the barriers that perpetuate disparities at home and abroad. This is a societal responsibility that can only be achieved through collective action endeavors. When talking about healthcare in this country, our conversation should never just devolve into just pills and procedures, but policies and partnership. We must untangle the complex web of socioeconomic factors that influence health, and no discipline can do this alone. As it's told in the African proverb, if you want to go fast, go alone. If you want to go far, you go together. Public health works best when we build bridges across sectors through a health and all policies approach. Now, humor me for a second. By show of hands, when you were asked as a child what you wanted to be when you grew up, how many of you said, a public health professional? Me neither. And for the parents here who don't understand what the heck you're gonna do with your degree and why it matters, in the past century alone, public health advancements increased life expectancy in the US by more than 25 years. Incredible, right? Keep listening. Yeah. Thanks to these folks up here. Public health fundamentally hinges on addressing social determinants of health, and those are the non-medical factors such as food security, transportation, safe housing, etc. 80% of our health outcomes are driven by these social determinants of health, but less than 5% of our total national health dollars are spent on public health activities. This is just one of the unacceptable paradoxes we must grapple with, where there is not only a lack of commitment to keeping people healthy in this country, but an absence of investment commensurate with that cause. The work we do is often thankless and underfunded, but is a rewarding profession of service. Public health is not merely a career, it is a calling. We are tasked with improving the health and well-being of entire communities, tackling systemic inequalities, and facing irascible challenges that plague our society. Now we are needed more than ever, as we have witnessed the far-reaching effects of politics and power on the very fabric of our work. We have seen science twisted and contorted to fit political agendas, leaving truth and evidence trampled in its wake. On top of this, we inherit a world where war, genocide, and racism persist. A climate crisis that for some reason is still under contention, where there are policies that criminalize women and transgender people's bodily autonomy, and where health outcomes are too often determined by zip codes. But I stand here today not to dwell on the problems, but to ignite the flame of leading with a healthy disregard for the impossible. Public health needs bold, empathetic, visionary leaders like us who are unafraid to disrupt existing paradigms and zealously forge new paths that ensure the conditions where every individual can enjoy a prolonged, healthy life. Throughout our time at Yale, we have been blessed with extraordinary opportunities to collaborate, learn, and grow as individuals and as a community. Replete with these tools, we are poised to become the change agents that our communities, our nation, and our world desperately need. And as we find ourselves in the inevitable flow of change, we possess the competence to lead that change. But remember, leadership is not confined to titles or skill sets. It's a commitment to constantly challenge the status quo, even when it feels uncomfortable, unpopular, or bureaucratic. American economist Peter Drucker said that management is doing things right. Leadership is doing the right things. Leading change does not come from the luxury of complacency. It stems from one powerful word: courage. Courage to examine our own complicity in systems of oppression, courage to listen to those whom you disagree with and finding compromise, and courage to wake up every day and not see the world as it is, but as it ought to be. For it is easy to become overwhelmed by the magnitude of these issues and succumb to cynicism. Yet I urge you to not get lost in the statistics and deficit framing, for behind every data point lies a human story. The work we do is deeply personal, and it is these stories that should fuel our drive to be catalysts of transformational change, unwavering advocates for evidence over misinformed ideology, and amplifiers of marginalized and disenfranchised voices. It's our obligation to stand up for those who are not in the room and can't represent themselves. You know, this degree grants us a debt. And I'm not talking about student loans here, although we have more than enough of that. I speak of the debt to your community. We owe our community our ears, our skills, and our voice. So be less concerned with who you have to stand up to and more concerned about who you're standing up for. You are, in so many ways, someone's greatest hope. Also, understand that with the scale of work we are charged to do, don't let perfect get in the way of progress. We may never witness such structural changes in our lifetime, but recognize the foundation we've laid in a long line of contributions that have come before us and paved the way for future generations to one day achieve those same goals. Most importantly, please, please, please take care of yourself to stay in the fight. I'll leave you with this. As we embark on our professional journeys, we'll always be students. I'll look at life not as peaks and valleys, but an ongoing process of learning and mastership. Know that as you leave these hallowed walls, you will not have the answer for everything, and that's okay. But ask the right questions. Stay curious. Be a productive skeptic. Finally, we are not just graduates of the Yale School of Public Health. We are torchbearers of a legacy that stretches back over a century and now join the ranks of the venerated leaders that have emerged from this very institution. The question becomes, what will you do with that torch while you have it? So, as we step forward to receive our diplomas, embrace this moment with gratitude, humility, and a sense of purpose. May our footsteps leave an indelible mark on the path toward a healthier, more equitable world. Congratulations.
Thank you, Kamali.